post-traumatic stress disorder, PTSD, presents a complex challenge in the mental health field, and this episode aligns with therapy training's course on effectively treating PTSD. Whether you're an experienced therapist, a counselor, or new to mental health, we aim to enhance your understanding and provide practical tools to better support your clients dealing with PTSD. Today, we're going to explore the theoretical foundations and diagnostic criteria of PTSD, evidence-based treatment approaches, the neurobiological aspects of trauma, and the cultural considerations that influence how trauma manifests. We'll also discuss common misconceptions surrounding PTSD, and I promise to sprinkle in some anecdotes along the way to keep our conversation engaging. So, let's get started. First, let's unpack what PTSD is. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, PTSD is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. Symptoms include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the event. To meet the criteria for PTSD, symptoms must persist for more than a month and cause significant impairment in social, occupational, or other important areas of functioning. When diagnosing PTSD, it's crucial to conduct a thorough assessment. In therapy trainings course, we emphasize the importance of understanding a client's trauma history. This involves not just identifying the traumatic events, but also exploring how these experiences have impacted their mental health. For example, a client might present with anxiety or depression, but a deeper dive reveals that these feelings stem from unresolved traumatic experiences. Now let's shift gears and talk about treatment approaches. Two evidence-based therapies for PTSD that we cover extensively in the course are cognitive behavioral therapy, or CBT, and eye movement desensitization and reprocessing, known as EMDR. CBT is grounded in the idea that our thoughts, feelings, and behaviors are interconnected. By helping clients recognize and change their negative thought patterns, we can significantly alleviate PTSD symptoms. For instance, if a client has a distorted belief that they are to blame for their trauma, we can work together to challenge that thought and replace it with a more balanced perspective. On the other hand, EMDR is a unique approach that involves processing trauma through bilateral stimulation, like guided eye movements. This therapy can help clients reprocess traumatic memories, reducing their emotional charge and allowing for healthier coping mechanisms. Imagine a client revisiting a traumatic memory while engaging in a set of eye movements. Over time, this can help them integrate the memory in a less distressing way. But treatment doesn't stop with just these therapies. It's essential to develop a comprehensive trauma assessment that takes into account not only the traumatic events, but also the individual's current coping mechanisms and support systems. This personalized approach is crucial for effective treatment planning. Speaking of coping mechanisms, let's delve into some therapeutic techniques that can help manage and reduce PTSD symptoms. Emotion regulation strategies, grounding exercises, and mindfulness practices are powerful tools in our therapeutic toolkit. For instance, you might guide a client through a grounding exercise, asking them to focus on their surroundings and describe 5 things they can see, 4 they can touch, 3 they can hear, 2 they can smell, and 1 they can taste. This technique helps anchor them in the present moment, reducing anxiety and panic. Mindfulness practices can also be helpful. Encouraging clients to engage in mindful breathing or meditation can foster a sense of calm and control. By teaching these skills, we empower our clients to manage their symptoms and improve their overall well-being. Now, let's talk about the neurobiological aspects of trauma. Understanding how trauma affects the brain can enhance our treatment decisions. Research shows that traumatic experiences can alter brain structures, particularly in areas responsible for memory and emotional regulation, such as the amygdala and hippocampus. This knowledge not only informs us about the biological underpinnings of PTSD, but also helps us explain these changes to our clients. When they understand that their symptoms are not just a result of weakness or failure, but rather a physiological response to trauma, it can alleviate some of the stigma and shame they may feel. As we journey through the complexities of PTSD, it's equally important to consider cultural factors that influence the manifestation of trauma. Different cultures have varying beliefs about trauma, mental health, and healing. For instance, a client from a collectivist culture may experience trauma differently than someone from an individualistic culture. Their support systems, coping skills, and even expressions of distress can differ significantly. Recognizing these cultural nuances allows us to provide culturally sensitive interventions that resonate with our clients' backgrounds. Now let's address some common misconceptions about PTSD. One prevalent myth is that PTSD only affects military personnel or first responders. While these groups are certainly at risk, PTSD can impact anyone who has experienced trauma, regardless of their background. In fact, studies show that individuals from diverse populations can experience trauma due to various life events, including domestic violence, natural disasters, and community violence. Another misconception is that people with PTSD are weak or just need to get over it. This belief can be harmful and stigmatizing. Trauma is a complex psychological response, and healing is often a long and challenging process. As mental health professionals, we have the opportunity to educate our clients and the community about the realities of PTSD, helping to dismantle these harmful stereotypes. As we start wrapping up, let's reflect on the core takeaways from our conversation. Understanding the theoretical foundations and diagnostic criteria of PTSD is paramount for accurate assessments. Utilizing evidence-based treatment approaches such as CBT and EMDR, while also incorporating emotion regulation strategies and mindfulness techniques, can significantly enhance our clients' coping mechanisms. Recognizing the neurobiological impacts of trauma and the cultural factors at play enables us to offer holistic treatment that respects our clients' individual experiences. As mental health professionals, our work is not just about helping clients overcome PTSD, it's about empowering them to reclaim their lives. We have the privilege of walking alongside them in their healing journey, providing support, education, and the tools they need to thrive. Before concluding, I encourage you to explore more about this topic and enhance your skills by visiting therapytrainings.com, where you can access the course on treating PTSD and many others. Continuous learning is key to providing our clients with the best support possible. So, as we part ways today, I invite you to ponder this. How can you apply what you've learned today to better serve your clients? What steps can you take to deepen your understanding of PTSD and its treatment? Remember, every bit of knowledge you gain can make a significant difference in someone's life. Thank you for joining me today in this important conversation. Until next time, keep learning, keep growing, and keep making a difference in the lives of those you serve.